So we are now in the sequence and context of the interview. The first part is the preparation, which includes reviewing the medical record, setting goals, reviewing your clinical behavior and appearance, lastly, adjusting the environment. So we are now in the sequence of the interview. After greeting the patient, establishing rapport, establishing the agenda, we are now in the inviting of the patient's story. So once you have elicited, negotiated, and prioritized the agenda, invite the patient's story by asking about the foremost concern. So, such as continue to encourage patients to tell their stories in their own words, using an open-ended approach. Do not interrupt the patient. After that, you should explore the patient's perspective. It is critical to explore the deeper meanings patient attach to their symptoms. The disease or illness distinction model acknowledges the different yet complementary perspectives of the clinician and the patient. To understand the patient's expectations, the clinician needs to go beyond just the attributes of a symptoms. This includes the patient's feelings, the patient's ideas about the nature and the cause of the problem, the effect of the problem on the patient's life and function, and the patient's expectations of the disease, of the clinician, or of the healthcare. So after that, you should identify and respond to the patient's emotional cues. If the patient does not mention the impact of the illness, probe the broader personal context of the illness by asking, how has this affected you? Or how did you feel about that? Or many people would be frustrated by something like this. Learn to respond immediately when you observe an emotional cue. We have here a mnemonic for responding to emotional cues. The NURES. N is for naming, U is for understanding or legitimization, and R for respecting. After that, you should expand and clarifying the patient's story using the 7 attributes, the old cards. O is for the onset. L is for location. D is for duration. C is for the character. A is for aggravating or the alleviating factors. R is for radiation. And lastly, letter T for timing. It is also important to establish the sequence and the time course of each of the patient's symptoms if you are to arrive at accurate assessments. To encourage a chronologic account, ask questions like, "What then?" or "What happened next?" or "Please start at the beginning." Or "The last time you felt well," and go step by step. In general, an interview moves back and forth from open-minded questions to increasingly focused questions, and then on to another open-ended question, returning the lead in the interview to the patient. So, next part is the generating and testing the diagnostic hypothesis. As you gain experience listening to the patient concerns, you will acquire the skills of clinical reasoning. You will generate and test the diagnostic hypothesis about what disease process might be present. And also by sharing the treatment plan. This multifaceted picture then forms the basis for planning further evaluation such as physical examination, laboratory tests, consultations, and negotiating a treatment plan. So after that, we should close the interview by validating the data obtained and let the patient know that the end of the interview is approaching to allow time for any final questions. Make sure that the patient understands the mutual plans you have developed. Next is you should summarize the salient features of the history as you understand it. Ask if the patient agrees with all the data gathered or if he wishes to clarify or make any corrections. Lastly, by briefing the patient about the physical examination you are about to perform.